Hello, and welcome to our Heart Health series. Our episode today is over cholesterol and physical activity. This is presented by the Abilene-Taylor County Public Health District. Starting off with cholesterol. So, what is it? Cholesterol is a fatty, waxy sort of substance that is used by our body to help create cell membranes, hormones, and vitamin D. There are two different types of cholesterol. One of them is HDL, which is high density lipoprotein. This one is typically what we consider a good cholesterol. This is because it helps to absorb and flush out contaminants through the liver. So it is generally very helpful. LDL, known as low density lipoprotein, is kind of known as the bad cholesterol. This one is usually associated with increased health risks whenever you have too much of this type of cholesterol. Whenever you hear people talk about having high cholesterol, typically it's the LDL cholesterol that we're worried about. There are a lot of different causes because health includes so many different parts of your life. Some of the causes of high cholesterol can be related to stress, inactivity, alcohol usage, certain medications, tobacco usage, secondhand smoke, mental health struggles, and consuming foods with saturated fat, as well as general nutrition. Since cholesterol is so important for our health, it is important to get it checked. One of the primary ways you have to do this is through blood tests. So this is typically done by a doctor or at a health fair. Typically, if you are asking for getting your cholesterol checked, that will be called a lipid test. Cholesterol is measured in milligrams per deciliter. So that will show up as mg/dl. Typically, a good goal for most people is about 200 milligrams per deciliter. And this drives into why exercise. So, as we discussed earlier, one of the causes of having high cholesterol is inactivity, and that's usually physical inactivity. This is why exercise is so important for our health overall, and especially our heart health. One of the primary things we look at whenever we're looking at exercise is getting our heart rate up. Because whenever our heart rate starts to get up, that means that our hearts and our lungs are getting stronger. Sadly, most Americans are not physically active enough, which is why exercise is such a big focus for keeping our hearts healthy. So while we're talking about exercise, how much exercise should you be getting? The general recommendations is about 130 minutes of moderate intensity physical activity or 75 minutes weekly of vigorous intensity physical activity. So what does moderate and vigorous really mean? For the moderate intensity, that is typically whenever you're doing a sort of exercise where your heartbeat is probably about 50 to 70% of your maximum heart rate. So think whenever you're like really exercising and you feel your heart and it's pumping a lot, that would be vigorous physical activity. But if it's pumping about like half as fast as that, then that might be more moderate. Moderate physical activity can be things like going on a little bit of a brisk walk, doing some light swimming, things like that. While vigorous physical activity could be a bit more intense, so like think of lifting weights, doing jump rope, or doing really intense yard work. Generally, you're going to want to break this down into segments in however that works out in your life, as well as make goals that actually work out for you. So if you're only able to do 20 minutes of exercise a week at first and you slowly build that up, that is great. What matters is that you're going out and you're doing physical activity and finding a way that it works in your life, because that's going to be able to help protect your heart and your overall health. So, on to the types of exercise. So, we know that there is moderate and vigorous types of exercise, but there's a few other categories to know as well, because exercise just doesn't take one form. And it includes a lot of different types of physical activity, whether it's something like you're doing your chores, you're gardening, or doing yard work, or even just standing and walking while you're on your phone. The three main categories that we're looking at is strength, flexibility, and aerobic. So strength is whenever you're building up those muscles in your body. This can be really important for helping to hold certain parts of your body in place, as well as be able to do types of activities going into your older age. Flexibility is the ability to move your body in whatever direction without pain or discomfort. And then aerobic is whenever you are doing exercises, kind of like we discussed, where your heart is beating a lot more. So that might be stuff like running. This is primarily in order to keep that heart healthy. Some things to keep in mind whenever you're looking at getting into exercise is first off to hydrate. So you kind of have to drink a lot more water than you might think you do whenever you're exercising. It's typically recommended that you get 1 cup of water per 10 to 20 minutes of exercise. As well as, of course, make sure that your clothing that you're wearing is breathable as well as safe. So you don't want to overheat while you're exercising or want to go exercise while it's freezing outside in shorts and a tank top. As well as you want to make sure that you are wearing fitting and comfortable athletic shoes. This is in order to prevent injury. You also want to make sure to both warm up and cool down. We do get the idea that, before you exercise, you're supposed to do some light stretching, a little bit of light movement before you get into the more intense types of workout. But you also want to make sure that you do that whenever you are cooling down from exercise. And of course, sometimes exercise doesn't feel very accessible to a lot of us. So there are quite a few barriers that you have to be mindful of and try and find ways to work around or work with. Some of these could be things like energy or having your schedule be full and not feeling like you can fit it in, as well as things like injuries or disability that might limit the ways that you are able to exercise in the more conventional or more talked about fashions, as well as lacking social support or lacking the environment to exercise. And then, of course, even the fear of injury. These are all things that you should be aware of, and it's important to take inventory of what issues and what barriers you might be facing. Because once you know what barriers are there, that's how you're going to be able to make a plan on how to work within or overcome certain barriers. One of the ways we can do this is through tailoring your type of activity. So, most of us go through types of ups and downs, and this can be more severe if you have some sort of condition. But generally, as we go on with life, day to day, or within the long term, your needs and abilities can change, which is why it's important to do exercises and integrate physical activity in a way that you can do sustainably. An example of this might be doing something like working within those ups and downs, and whenever you're not able to do as much, focusing on doing things while you're laying down or sitting in a chair, or talking to a healthcare provider to see what exactly you should be doing. The same thing applies with flare ups. So, certain conditions can lead to flare ups. It's important to listen to what your warning signs are and pay attention to your limits. Sometimes, whenever we start to think about our health, we just want to jump right into doing all the exercise. But it's important to recognize your limits and do what you can so that you prevent those flare ups, as well as knowing what signs there are of flare ups. So maybe you can lessen the load a little bit so they don't get as severe. And then, of course, just generally focusing on that self care. And if you have access to a doctor, then it's important to ask some questions, such as what kind of exercises should I be doing? What type of exercises should I be prioritizing? When would be best for me to exercise? As well as how should you be exercising? Should you be doing exercises while you're sitting down? These are all good questions to have, and it really helps you figure out a plan of what might work out for you. And overall, whenever we're discussing integrating physical activity into your life more and focusing on how that impacts your health overall, it's important to also focus on self care. Your ability to care for other people as well as yourself is largely dependent on your health overall. That means whether it's your physical, emotional, social, or mental health, it's important to find a way to prioritize those things in order to sustain yourself in the long term. One saying is your health is care. So physical activity is a type of self-care, even if it might not always feel like it in the moment. It's a way in order to make sure that you are able to sustain your health in the long term and able to take better care of yourself as well as others. With this, it can be helpful sometimes to develop some sort of self-care routine that can go hand in hand with physical activity. Finding ways to both take care of your mental health or to make just physical activity feel a little bit more fun can really help you sustain whatever routine you have set up to stay more active. All right, so that's the end of this episode over cholesterol and physical activity. Thank you so much for listening, and I can't wait to see you for the next one.